Free CNA Practice Test 2026 Most Common Questions and Answers. Question 1. What is the definition of dysuria? Option A. Large amounts of urine. Option B. Scant amounts of urine. Option C. Painful or difficult urination. Option D. Sugar in the urine. The correct answer is option C. Painful or difficult urination. Dysuria is a common symptom of a urinary tract infection. Question 2. Which term describes the production of abnormally large amounts of urine? Option A. Oliguria. Option B. Polyuria. Option C. Dysuria. Option D. Pyuria. The correct answer is option B. Polyuria. Polyuria is often associated with conditions like diabetes. Question 3. Which term describes the production of a scant or small amount of urine? Option A. Polyuria. Option B. Oliguria. Option C. Hematuria. Option D. Anuria. The correct answer is option B. Oliguria. Oliguria can be a sign of dehydration or kidney failure. Question 4. What is a colostomy? Option A. An opening between the small intestine and the abdomen. Option B. An opening between the large intestine and the abdominal wall. Option C. A tube inserted into the stomach. Option D. A surgery to remove the gallbladder. The correct answer is option B. An opening between the large intestine and the abdominal wall. A colostomy allows stool to exit the body through a stoma into a pouch. Question 5. What is the medical term for the act of excreting feces from the rectum? Option A. Defecation. Option B. Voiding. Option C. Emesis. Option D. Flatulence. The correct answer is option A. Defecation. Defecation is the final step in the digestive process. Question 6. What is an enema? Option A. A type of medication for fever. Option B. A fluid injected into the rectum and lower colon. Option C. A tube used for oxygen. Option D. A device to measure heart rate. The correct answer is option B. A fluid injected into the rectum and lower colon. Enemas are used to relieve constipation or clear the bowel before a procedure. Question 7. Which medical term refers to excessive gas or air in the stomach or intestines? Option A. Emesis. Option B. Flatus. Option C. Flatulence. Option D. Sputum. The correct answer is option C. Flatulence. Flatulence is the condition of having excessive intestinal gas. Question 8. What is an ileostomy? Option A. An opening between the large intestine and the abdomen. Option B. An opening between the small intestine and the abdominal wall. Option C. A surgery to remove the kidneys. Option D. A tube used for bladder drainage. The correct answer is option B. An opening between the small intestine and the abdominal wall. Ileostomies typically produce liquid stool because the large intestine is bypassed. Question 9. What is an ostomy? Option A. A surgically created opening into the body. Option B. A type of blood test. Option C. A medication for pain. Option D. A physical therapy exercise. The correct answer is option A. A surgically created opening into the body. Ostomies are used for elimination when the normal path is blocked or damaged. Question 10. What is a stoma? Option A. The bag used to collect stool. Option B. The opening seen through the abdominal wall. Option C. A type of surgical stitch. Option D. The muscle used for breathing. The correct answer is option B. The opening seen through the abdominal wall. The stoma is the actual part of the intestine that is visible on the surface of the skin. Question 11. What is a suppository? Option A. A liquid medication for the ears. Option B. A cone-shaped solid drug inserted into the rectum. Option C. A type of pill swallowed with water. Option D. A medicated cream for the skin. The correct answer is option B. A cone-shaped solid drug inserted into the rectum. Suppositories melt at body temperature to deliver medication. Question 12. What is 10 o'clock in the morning in military time? Option A, 1000. Option B, 2200. Option C, 0100. Option D, 1200. The correct answer is option A, 1000. Military time uses a 24-hour clock starting at midnight. Question 13. What is 10 o'clock at night in military time? Option A, 1000. Option B, 2200. Option C, 2000. Option D, 0010. The correct answer is option B, 2200. Adding 12 hours to any PM time gives the military time. Question 14. What is the definition of aspiration? Option A, difficulty swallowing food. Option B, reduced amounts of water in the body. Option C, breathing fluid or an object into the lungs. Option D, the backward flow of stomach acid. The correct answer is option C, breathing fluid or an object into the lungs. Aspiration is a serious risk for residents with swallowing difficulties. Question 15. What is the definition of dehydration? Option A, swelling of the body tissues. Option B, an excessive loss of water from the body. Option C, a rapid heart rate. Option D, the inability to speak. The correct answer is option B, an excessive loss of water from the body. Dehydration occurs when fluid output exceeds fluid intake. Question 16. What is dysphagia? Option A, difficulty breathing. Option B, difficulty swallowing. Option C, the loss of memory. Option D, a type of skin rash. The correct answer is option B, difficulty swallowing. Residents with dysphagia may need thickened liquids to eat safely. Question 17. What is regurgitation? Option A, the forward flow of blood. Option B, the backward flow of stomach contents into the mouth. Option C, a type of deep breathing. Option D, the process of healing a wound. The correct answer is option B, the backward flow of stomach contents into the mouth. Regurgitation is different from vomiting and often happens with acid reflux. Question 18. Which nutrient is primarily responsible for tissue growth and repair? Option A, carbohydrates. Option B, fats. Option C, protein. Option D, minerals. The correct answer is option C, protein. Protein is the building block of all cells in the human body. Question 19. A pureed diet consists of foods that have which consistency? Option A, clear liquid. Option B, baby food consistency. Option C, semi-solid and chunky. Option D, high fiber and seeds. The correct answer is option B, baby food consistency. Pureed food is blended until smooth for residents who cannot chew. Question 20. How full should a spoon be when feeding a dependent resident? Option A, 1/3 full. Option B, half full. Option C, completely full. Option D, it does not matter. The correct answer is option A, 1/3 full. Small amounts on the spoon help prevent choking and allow for easier swallowing. Question 21. What is a nasogastric tube? Option A, a feeding tube inserted through an opening in the stomach. Option B, a feeding tube inserted through the nose into the stomach. Option C, a tube used to drain the bladder. Option D, a device to measure oxygen. The correct answer is option B, a feeding tube inserted through the nose into the stomach. These tubes are used when a resident cannot take nutrition by mouth. Question 22. Which of the following is an example of a thicker liquid consistency? Option A, nectar. Option B, a honey. Option C, water. Option D, coffee. The correct answer is option B, honey. Honey-thick liquids are much more viscous than nectar-thick liquids. Question 23. What is the average normal oral temperature for an adult? Option A, 97.6. Option B, 98.6. Option C, 99.6. Option D, 100.6. The correct answer is option B, 98.6. 98.6 degrees Fahrenheit is considered the standard baseline for body temperature. Question 24. What is the average normal rectal temperature for an adult? Option A, 97.6. Option B, 98.6. Option C, 99.6. Option D, 100.6. The correct answer is option C, 99.6. Rectal temperatures are generally 1 degree higher than oral readings. Question 25. What is the average normal axillary temperature for an adult? Option A, 97.6. Option B, 98.6. Option C, 99.6. Option D, 100.6. The correct answer is option A, 97.6. Axillary temperatures are generally 1 degree lower than oral readings. Question 26. Which thermometer typically has a red tip? Option A, oral thermometer. Option B, axillary thermometer. Option C, rectal thermometer. Option D, a temporal thermometer. The correct answer is option C, rectal thermometer. Red color coding is used to prevent the accidental use of a rectal thermometer in the mouth. Question 27. How long should you leave a rectal thermometer in place for a manual reading? Option A, 1 minute. Option B, 2 minutes. Option C, 5 minutes. Option D, 10 minutes. The correct answer is option B, 2 minutes. A 2-minute period ensures an accurate core temperature reading. Question 28. What is the normal resting pulse rate for a healthy adult? Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 100 to 120 beats per minute. Option D, 120 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. A resting heart rate between 60 and 100 is the expected normal range. Question 29. How long should you count a radial pulse if the heart rate is regular? Option A, 15 seconds. Option B, 30 seconds. Option C, 1 minute. Option D, 2 minutes. The correct answer is option B, 30 seconds. Multiplying a 30-second count by 2 is an accurate way to get the beats per minute. Question 30. How long must you count an irregular pulse to get an accurate reading? Option A, 30 seconds. Option B, 45 seconds. Option C, 1 full minute. Option D, 2 minutes. The correct answer is option C, 1 full minute. A full minute is needed to properly assess the rhythm and rate of an irregular pulse. Question 31. What is the normal range for a systolic blood pressure reading? Option A, 60 to 80. Option B, 90 to 120. Option C, 120 to 140. Option D, 140 to 160. The correct answer is option B, 90 to 120. Systolic pressure represents the force when the heart is contracting. Question 32. What is the normal range for a diastolic blood pressure reading? Option A, 40 to 60. Option B, 60 to 80. Option C, 80 to 100. Option D, 100 to 120. The correct answer is option B, 60 to 80. Diastolic pressure represents the force when the heart is at rest. Question 33. What is the medical name for a blood pressure cuff? Option A, stethoscope. Option B, sphygmomanometer. Option C, thermometer. Option D, otoscope. The correct answer is option B, sphygmomanometer. This device is used along with a stethoscope to measure blood pressure. Question 34. When is the best time to weigh a resident to ensure accuracy? Option A, after a large meal. Option B, in the evening before bed. Option C, in the morning before breakfast after voiding. Option D. In the middle of the afternoon. The correct answer is option C. In the morning before breakfast after voiding. Weighing at the same time daily under the same conditions provides the most accurate data. Question 35. Where are venous ulcers typically located? Option A. On the face. Option B. On the lower legs and ankles. Option C. On the palms of the hands. Option D. On the stomach. The correct answer is option B. On the lower legs and ankles. Venous ulcers are caused by poor blood return from the legs to the heart. Question 36. What is gangrene? Option A. A red and itchy rash. Option B. Tissue death that causes the skin to become black. Option C. A bacterial infection in the lungs. Option D. A type of bone fracture. The correct answer is option B. Tissue death that causes the skin to become black. Gangrene is a serious condition that often requires surgical intervention or amputation. Question 37. When should anti-embolism stockings be applied to a resident? Option A. After they have walked for an hour. Option B. In the evening before sleep. Option C. In the morning before they get out of bed. Option D. Directly after a shower. The correct answer is option C. In the morning before they get out of bed. Applying stockings before the resident stands helps prevent leg swelling. Question 38. What is a sitz bath? Option A. A bath where the entire body is submerged. Option B. A bath where the perineal and rectal area are immersed in warm water. Option C. A bath used to wash the hair. Option D. A type of dry heat treatment. The correct answer is option B. A bath where the perineal and rectal area are immersed in warm water. Sitz baths are used to promote healing and comfort in the pelvic area. Question 39. What is a bony prominence? Option A. An area where bone lies close to the skin surface. Option B. A type of bone cancer. Option C. A broken bone that has healed. Option D. A very strong muscle. The correct answer is option A. An area where bone lies close to the skin surface. Bony prominences like the heels and tailbone are high-risk areas for pressure sores. Question 40. In skin care, what is friction? Option A. Layers of skin rubbing against each other. Option B. The rubbing of one thing against another like skin against a sheet. Option C. A type of bacterial infection. Option D. The process of a wound closing. The correct answer is option B. The rubbing of one thing against another like skin against a sheet. Friction can cause skin tears and contribute to the formation of pressure ulcers. Question 41. What is skin shearing? Option A. Cutting the hair on the skin. Option B. When layers of skin rub against each other. Option C. The process of skin becoming very dry. Option D. A type of skin allergy. The correct answer is option B. When layers of skin rub against each other. Shearing occurs when the skin stays in place while the underlying tissue moves. Question 42. What is eschar? Option A. Clear fluid from a wound. Option B. Black dead leathery tissue found in a wound. Option C. A type of surgical drain. Option D. A medicated bandage. The correct answer is option B. Black dead leathery tissue found in a wound. Eschar must be removed for a deep pressure ulcer to heal. Question 43. What is SLU? Option A. New muscle tissue. Option B. Yellow or white stringy tissue in a wound. Option C. A type of cleaning solution. Option D. A surgical tool. The correct answer is option B. Yellow or white stringy tissue in a wound. SLU is dead tissue that must be removed from a wound bed. Question 44. How often should a resident's position be changed when they are sitting in a chair? Option A. Every hour. Option B. Every 2 hours. Option C. Every 15 minutes. Option D. Once a day. The correct answer is option C. Every 15 minutes. Frequent movement is necessary to prevent pressure on the tailbone while sitting. Question 45. What is restorative nursing care? Option A. Care that focuses only on end of life. Option B. Care that helps residents regain health and independence. Option C. Care provided only in hospitals. Option D. Care that involves performing surgery. The correct answer is option B. Care that helps residents regain health and independence. Restorative care maintains the progress made during formal rehabilitation. Question 46. What is a delusion of grandeur? Option A. A fear of being in small spaces. Option B. Reliving a trauma. Option C. An exaggerated belief about one's importance or power. Option D. The loss of ability to speak. The correct answer is option C. An exaggerated belief about one's importance or power. This is a common symptom in certain mental health disorders. Question 47. What is sundowning? Option A. When a resident feels best in the morning. Option B. The process of the sun setting. Option C. When Alzheimer's behaviors increase during hours of darkness. Option D. A type of skin rash. The correct answer is option C. When Alzheimer's behaviors increase during hours of darkness. Increased confusion and agitation in the evening is common in dementia patients. Question 48. What is the medical term for a stroke? Option A. Myocardial infarction. Option B. Cerebrovascular accident. Option C. Hypertension. Option D. Angina. The correct answer is option B. Cerebrovascular accident. A stroke is caused by a blockage or rupture of a blood vessel in the brain. Question 49. What is the first stage of the grieving process according to Elizabeth Kubler-Ross? Option A. Anger. Option B. Denial. Option C. Bargaining. Option D. Depression. The correct answer is option B. Denial. Denial is a defense mechanism that helps a person process shocking news. Question 50. Which of the 5 senses is thought to be the last one lost when a person is dying? Option A. Sight. Option B. Hearing. Option C. Taste. Option D. Touch. The correct answer is option B. Hearing. Caregivers should continue to speak to residents even if they appear unresponsive. Question 51. What is rigor mortis? Option A. A state of deep sleep. Option B. The stiffness of muscles that occurs after death. Option C. A type of infection. Option D. The process of the heart stopping. The correct answer is option B. The stiffness of muscles that occurs after death. Rigor mortis usually begins a few hours after death. Question 52. Where is the radial pulse located? Option A. In the neck. Option B. At the wrist on the thumb side. Option C. Inside the elbow. Option D. At the groin. The correct answer is option B. At the wrist on the thumb side. The radial artery is the most common site for taking a routine pulse. Question 53. What is bradypnea? Option A. Rapid breathing. Option B. Slow breathing. Option C. Absence of breathing. Option D. Painful breathing. The correct answer is option B. Slow breathing. Bradypnea is a respiration rate that is lower than normal. Question 54. What is tachypnea? Option A. Slow breathing. Option B. Rapid breathing. Option C. Normal breathing. Option D. Absence of breathing. The correct answer is option B. Rapid breathing. Tachypnea is a respiration rate that is higher than 20 breaths per minute. Question 55. What is a pathogen? Option A. A helpful microbe. Option B. A harmful microbe that causes infection. Option C. A type of cleaning chemical. Option D. A professional healthcare worker. The correct answer is option B. A harmful microbe that causes infection. Pathogens include bacteria and viruses that make people sick. Question 56. What does sterile mean? Option A. Very clean. Option B. The absence of all microbes. Option C, free of visible dirt. Option D, using a lot of soap. The correct answer is option B, the absence of all microbes. Sterility is required for invasive procedures like surgery. Question 57. What is a sepsis? Option A, a serious infection in the blood. Option B, being free of disease-producing microbes. Option C, the growth of bacteria. Option D, a medical diagnosis. The correct answer is option B, being free of disease-producing microbes. Aseptic techniques are used to keep the environment safe for residents. Question 58. What does NKA stand for in medical records? Option A, normal knee alignment. Option B, no known allergies. Option C, nursing knowledge area. Option D, new kidney assessment. The correct answer is option B, no known allergies. This informs staff that the resident has no allergies on file. Question 59. What does NPO stand for? Option A, new patient only. Option B, nothing by mouth. Option C, normal pulse only. Option D, nighttime position order. The correct answer is option B, nothing by mouth. Residents who are NPO cannot have any food or fluids by mouth. Question 60. Which factor of hand washing is most responsible for removing germs? Option A, the temperature of the water. Option B, a friction from rubbing hands together. Option C, the brand of soap. Option D, the type of paper towel. The correct answer is option B, friction from rubbing hands together. Friction physically removes pathogens from the surface of the skin. Question 61. On which side should a resident hold a cane for support? Option A, the weak side. Option B, the strong side. Option C, the side they prefer. Option D, it does not matter. The correct answer is option B, the strong side. Holding the cane on the strong side helps support the weight of the weak side. Question 62. Which side do you dress first if a resident has a weak left side? Option A, the right side. Option B, the left side. Option C, the strongest side. Option D, the side without the identification band. The correct answer is option B, the left side. Always dress the weak side first to make the process easier for the resident. Question 63. What is the medical term for a heart attack? Option A, myocardial infarction. Option B, cerebrovascular accident. Option C, hypertension. Option D, angina. The correct answer is option A, myocardial infarction. A heart attack happens when the heart muscle does not get enough oxygen. Question 64. What does the acronym RACE stand for in fire safety? Option A, run, alarm, call, exit. Option B, rescue, alarm, confine, extinguish. Option C, rescue, activate, clear, evacuate. Option D, remove, alarm, contain, extinguish. The correct answer is option B, rescue, alarm, confine, extinguish. This is the standard procedure followed by healthcare staff during a fire. Question 65. How many milliliters are in 1 fluid ounce? Option A, 10 milliliters. Option B, 30 milliliters. Option C, 60 milliliters. Option D, 100 milliliters. The correct answer is option B, 30 milliliters. The conversion factor of 30 is used to calculate intake and output. Question 66. What unit is used to measure blood pressure? Option A, milliliters. Option B, millimeters of mercury. Option C, degrees Fahrenheit. Option D, pounds. The correct answer is option B, millimeters of mercury. Blood pressure is recorded as two numbers representing systolic and diastolic forces. Question 67. What is the clinical term for difficult or painful urination? Option A, hematuria. Option B, dysuria. Option C, nocturia. Option D, polyuria. The correct answer is option B, Dysuria. Dysuria is often a sign of an infection in the bladder or kidneys. Question 68. What is the clinical term for blood in the urine? Option A, dysuria. Option B, hematuria. Option C, nocturia. Option D, polyuria. The correct answer is option B, hematuria. Hematuria can be visible to the eye or microscopic. Question 69. How often must a physical restraint be released for care? Option A, once per shift. Option B, every hour. Option C, every 2 hours. Option D, once a day. The correct answer is option C, every 2 hours. Removing the restraint every 2 hours allows for movement and skin checks. Question 70. What does it mean if a resident is diaphoretic? Option A, they are having a seizure. Option B, they are sweating heavily. Option C, they are unable to speak. Option D, they are extremely hungry. The correct answer is option B, they are sweating heavily. Diaphoresis is a clinical sign that must be reported to the nurse. Question 71. What is the term for a resident leaving the facility without notice? Option A, exit. Option B, elopement. Option C, escape. Option D, evacuation. The correct answer is option B, elopement. Elopement is a major safety concern for residents with dementia. Question 72. What does the term atrophy mean? Option A, the growth of a muscle. Option B, the wasting away of a muscle. Option C, a type of headache. Option D, the healing of a wound. The correct answer is option B, the wasting away of a muscle. Atrophy occurs when muscles are not used or due to disease. Question 73. Which blood vessels carry blood away from the heart? Option A, veins. Option B, arteries. Option C, capillaries. Option D, venules. The correct answer is option B, arteries. Arteries carry oxygenated blood to the body's tissues. Question 74. Which blood vessels carry blood back to the heart? Option A, arteries. Option B, veins. Option C, arterioles. Option D, capillaries. The correct answer is option B, veins. Veins bring deoxygenated blood back to the heart for processing. Question 75. What is the normal range for adult oxygen concentration? Option A, 80 to 90%. Option B, 95 to 100%. Option C, 50 to 60%. Option D, 100 to 110%. The correct answer is option B, 95 to 100%. Oxygen levels are measured using a device called a pulse oximeter. Question 76. What is the first step when discovering a fire in a resident's room? Option A, yell fire. Option B, call the nurse. Option C, remove the resident from danger. Option D, open the windows. The correct answer is option C, remove the resident from danger. The rescue step is always the priority to ensure the safety of the person. Question 77. What temperature of water should be used to clean dentures? Option A, boiling hot water. Option B, cool or lukewarm water. Option C, freezing cold water. Option D, no water needed. The correct answer is option B, cool or lukewarm water. Hot water can warp and ruin the material used to make dentures. Question 78. Which medical term is used for vomit? Option A, flatulence. Option B, emesis. Option C, flatus. Option D, sputum. The correct answer is option B, emesis. Nursing assistants must document the characteristics of emesis. Question 79. What does the term hypoxia mean? Option A, too much oxygen. Option B, cells do not have enough oxygen. Option C, a type of blood clot. Option D, a rapid heart rate. The correct answer is option B, cells do not have enough oxygen. Hypoxia is a dangerous condition that requires immediate oxygen therapy. Question 80. Where should a Foley drainage bag be hung on a bed? Option A, the side rail. Option B, the bed frame. Option C, the headboard. Option D, the footboard. The correct answer is option B, the bed frame. Hanging the bag on the frame prevents pulling when the rails are moved. Question 81. What is the clinical term for difficult swallowing? Option A, dysphagia. Option B, dysphagia. Option C, dyspnea. Option D, dysuria. The correct answer is option B, dysphagia. Dysphagia is a serious condition that increases the risk of choking and aspiration. Question 82. What is the normal range for an adult pulse? Option A, 40 to 60. Option B, 60 to 100. Option C, 100 to 120. Option D, 120 to 140. The correct answer is option B, 60 to 100. The pulse rate is measured in beats per minute. Question 83. How long do you count respirations for accuracy? Option A, 15 seconds. Option B, 30 seconds. Option C, 1 full minute. Option D, 2 minutes. The correct answer is option C, 1 full minute. Counting for 1 full minute ensures the rate and rhythm are accurately captured. Question 84. What unit is used for recording fluid intake and output? Option A, ounces. Option B, milliliters. Option C, pounds. Option D, inches. The correct answer is option B, milliliters. Consistent measurement in milliliters is required for medical documentation. Question 85. What does the term cyanosis mean? Option A, yellow skin. Option B, blue or gray skin color. Option C, a red rash. Option D, pale skin. The correct answer is option B, blue or gray skin color. Cyanosis is caused by a lack of oxygen in the blood. Question 86. Which nutrient provides energy and fiber? Option A, fats. Option B, carbohydrates. Option C, proteins. Option D, minerals. The correct answer is option B, carbohydrates. Carbohydrates are the main fuel source for the body's cells. Question 87. What is the best way to prevent the spread of infection? Option A, wearing a mask. Option B, hand washing. Option C, using gloves. Option D, closing doors. The correct answer is option B, hand washing. Frequent and proper hand washing is the most effective defense against germs. Question 88. Which of the following is a specific beginning procedure action when entering a resident room? Option A, assemble equipment and knock on the door. Option B, check the diet order. Option C, adjust the resident's position. Option D, empty the drainage bag. The correct answer is option A, assemble equipment and knock on the door. Knocking and gathering supplies are the first steps to ensure privacy and efficiency before starting care. Question 89. What should a nursing assistant do immediately after identifying themselves to a resident? Option A is start the procedure. Option B, address the resident by name. Option C, close the curtains. Option D, wash their hands. The correct answer is option B, address the resident by name. Using the resident's name builds rapport and ensures you are providing care to the correct person. Question 90. When providing privacy during a procedure, which of the following actions should be taken? Option A, turn off the lights. Option B, ask the resident to look away. Option C, pull the curtains and shut the door. Option D, tell the roommate to leave the building. The correct answer is option C, pull the curtains and shut the door. Privacy curtains and doors are essential for maintaining the resident's dignity and legal rights. Question 91. How should a nursing assistant explain a procedure to a resident for effective communication? Option A, speak quickly to save time. Option B is speak clearly and maintain face-to-face contact. Option C, use complex medical terms. Option D, talk to the family instead. The correct answer is option B. Speak clearly and maintain face-to-face contact. Clear speech and eye contact ensure the resident understands and can participate in their care. Question 92. What is the standard ending procedure action before leaving a resident alone? Option A, turn off the call light. Option B, return the bed to its lowest position. Option C, leave the curtains closed tightly. Option D, remove the resident's shoes. The correct answer is option B. Return the bed to its lowest position. Lowering the bed is a critical safety measure to prevent injury if a resident attempts to get up. Question 93. Where should the signal cord or call light be placed when a procedure is finished? Option A, on the floor. Option B, under the pillow. Option C, within the resident's reach. Option D, on the nurse station. The correct answer is option C, within the resident's reach. Accessibility of the call light is the resident's only way to summon help when they are alone. Question 94. What is the final step of every clinical procedure to ensure infection control? Option A, reporting to the nurse. Option B, cleaning the equipment. Option C, washing your hands. Option D, opening the curtains. The correct answer is option C, washing your hands. Hand hygiene after care prevents the spread of pathogens throughout the facility. Question 95. When taking blood pressure, where should the diaphragm of the stethoscope be placed? Option A, over the radial artery. Option B, over the brachial artery at the elbow. Option C, on the back of the neck. Option D, under the armpit. The correct answer is option B, over the brachial artery at the elbow. The brachial pulse at the antecubital space is the standard site for auscultating blood pressure. Question 96. To what pressure should a blood pressure cuff typically be inflated if the method is not specified? Option A, 100 mm of mercury. Option B, 180 mm of mercury. Option C, 300 mm of mercury. Option D, 50 mm of mercury. The correct answer is option B, 180 mm of mercury. Inflating to 180 ensures you are above the systolic pressure for most residents without causing unnecessary pain. Question 97. When straightening the ear canal for a tympanic temperature, how should you pull the ear? Option A, pull gently forward. Option B, pull straight down. Option C, pull back and up. Option D, do not move the ear. The correct answer is option C, pull back and up. Pulling the pinna back and up aligns the ear canal with the eardrum for an accurate reading. Question 98. Before taking an oral temperature, how long should you wait if a resident has just smoked? Option A, 1 minute. Option B, 5 minutes. Option C, 15 minutes. Option D, 1 hour. The correct answer is option C, 15 minutes. Smoking alters the temperature of the oral cavity and requires a recovery period for accuracy. Question 99. When counting a radial pulse for 30 seconds, how is the final beats per minute rate determined? Option A, subtract 10. Option B, divide by 2. Option C, multiply by 2. Option D, keep the number as is. The correct answer is option C, multiply by 2. Multiplying the 30-second count by 2 provides the rate for 1 full minute. Question 100. How long should a nursing assistant count respirations to ensure the most accurate rate? Option A, 15 seconds. Option B, 30 seconds. Option C, 1 full minute. Option D, 2 minutes. The correct answer is option C, 1 full minute. A full minute is necessary to observe the rhythm, depth, and character of breathing. Question 101. During hand washing, how long should the friction or scrubbing portion take? Option A, 2 seconds. Option B, 5 to 10 seconds. Option C, 15 to 30 seconds. Option D, 5 minutes. The correct answer is option C, 15 to 30 seconds. 15 to 30 seconds of vigorous scrubbing is the standard for effective pathogen removal. Question 102. What should be used to turn off a water faucet after hand washing to prevent recontamination? Option A, your clean hands. Option B, your elbow. Option C, a dry paper towel. Option D, a wet washcloth. The correct answer is option C, a dry paper towel. Using a dry paper towel prevents germs on the handle from transferring back to your clean hands. Question 103. Which of the following is an effective way to prevent pressure ulcers? Option A, keeping the head of the bed at 90 degrees. Option B, using pillows to reduce skin-to-skin contact. Option C, giving the resident more salt. Option D is scrubbing reddened areas with a brush. The correct answer is option B, using pillows to reduce skin-to-skin contact. Pillows can bridge bony prominences and prevent friction or pressure between limbs. Question 104. Where should the tubing of a Foley catheter be secured to prevent pulling? Option A, to the bed rail. Option B, to the headboard. Option C, to the resident's inner thigh or abdomen. Option D, to the forepole. The correct answer is option C, to the resident's inner thigh or abdomen. Securing the tube to the body prevents trauma to the urethra and accidental removal. Question 105. Where must a urinary drainage bag always be attached on a bed? Option A, to the side rail. Option B, to the bed frame below the bladder. Option C, to the footboard. Option D, on the floor. The correct answer is option B, to the bed frame below the bladder. The bag must be on a non-moving part of the bed and kept low to facilitate gravity flow. Question 106. When placing an oxygen nasal cannula, where should the tubing be positioned? Option A, behind the head. Option B, around the ears and under the chin. Option C, over the eyes. Option D, tucked into the resident's shirt. The correct answer is option B, around the ears and under the chin. Correct placement ensures the prongs stay in the nasal passage and minimizes skin irritation. Question 107. What should a nursing assistant do if they notice the oxygen flow meter is at the wrong rate? Option A, adjust it immediately. Option B, turn the oxygen off. Option C, alert the nurse immediately. Option D, ignore it as it is not their job. The correct answer is option C, alert the nurse immediately. Assistants are not permitted to adjust oxygen rates but must report errors to the licensed nurse. Question 108. Which of the following is a safety guideline for residents using oxygen? Option A, ensure matches are available for lighting candles. Option B, keep electrical equipment in good repair. Option C, allow kinks in the tubing for comfort. Option D, remove the cannula whenever the resident talks. The correct answer is option B, keep electrical equipment in good repair. Oxygen is highly combustible, and electrical sparks can lead to a fire or explosion. Question 109. During an occupied draw sheet change, what is done after raising the side rail and turning the resident? Option A, remove the clean sheet. Option B, tuck in the clean draw sheet on the working side. Option C, lower the bed to the floor. Option D, give the resident a drink. The correct answer is option B, tuck in the clean draw sheet on the working side. Preparing the clean side before rolling the resident back ensures a smooth and efficient linen change. Question 110. What is the first step in treating a conscious choking resident? Option A, perform chest compressions. Option B, ask the resident if they are choking. Option C, give them a glass of water. Option D, lay them on their side. The correct answer is option B, ask the resident if they are choking. Confirming the resident cannot breathe or speak identifies a total airway obstruction. Question 111. Where should you position your fist when performing abdominal thrusts on a choking resident? Option A, on the chest. Option B, directly on the belly button. Option C, slightly above the navel. Option D. On the lower back. The correct answer is option C. Slightly above the navel. Placement above the navel allows for an effective inward and upward thrust to dislodge the object. Question 112. What should a nursing assistant do before assisting a resident onto a standing scale? Option A. Adjust the resident's clothing. Option B. Move the scale weight to 0. Option C. Give the resident a snack. Option D. Ask the resident to jump. The correct answer is option B. Move the scale weight to 0. Zeroing the scale is necessary to obtain an accurate starting point for the measurement. Question 113. When measuring a resident's height on a standing scale, where should the measuring bar rest? Option A. On top of the resident's hair. Option B. On the resident's forehead. Option C. On the flat top of the head. Option D. Against the resident's nose. The correct answer is option C. On the flat top of the head. The bar must be level with the top of the skull for an accurate height reading. Question 114. When should anti-embolism stockings be applied for maximum effectiveness? Option A. While the resident is walking. Option B. Directly after a heavy meal. Option C. While the resident is in bed or with feet elevated. Option D. Only at night. The correct answer is option C. While the resident is in bed or with feet elevated. Applying stockings before the legs swell from standing ensures they provide proper compression. Question 115. How should a nursing assistant move a joint during passive range of motion? Option A. Quickly and with force. Option B. Past the point of pain to increase flexibility. Option C. Gently and avoid fast, jerky movements. Option D. Only one time per joint. The correct answer is option C. Gently and avoid fast, jerky movements. Slow, rhythmic movements prevent muscle strain and joint injury. Question 116. What is the correct angle for a resident in Fowler's position? Option A. 10 to 20 degrees. Option B. 30 to 45 degrees. Option C. 60 to 90 degrees. Option D. Flat on the back. The correct answer is option C. 60 to 90 degrees. High Fowler's position is an upright sitting position used for eating and breathing support. Question 117. In the Sims position, how is the resident placed? Option A. On their back with legs straight. Option B. On the left or right side with the upper leg flexed. Option C. On their stomach with arms at sides. Option D. Sitting upright with knees bent. The correct answer is option B. On the left or right side with the upper leg flexed. Sims position is a semi-prone position often used for enemas or rectal treatments. Question 118. Where should a nursing assistant stand when assisting a resident with a weak side to walk? Option A. On the resident's strong side. Option B. Directly in front of the resident. Option C. At the resident's side or slightly behind on the weak side. Option D. 3 feet away from the resident. The correct answer is option C. At the resident's side or slightly behind on the weak side. Supporting the weak side provides a safety net if the resident loses their balance. Question 119. When transferring a resident from bed to wheelchair, where should the wheelchair be positioned? Option A. At the foot of the bed. Option B. On the resident's strong side. Option C. Behind the resident. Option D. 2 feet away from the bed. The correct answer is option B. On the resident's strong side. Positioning on the strong side allows the resident to help pull themselves into the chair. Question 120. What is the first action when feeding a dependent resident? Option A. Give them a large drink of water. Option B. Check that the name and diet on the tray match the resident. Option C. Start with the dessert. Option D. Mix all the food together. The correct answer is option B. Check that the name and diet on the tray match the resident. Verifying the identity and diet prevents medical errors and allergic reactions. Question 121. At what angle should a resident be positioned for safe feeding? Option A, flat on their back. Option B, minimum of 30 degrees. Option C, minimum of 60 degrees. Option D, standing up. The correct answer is option C, minimum of 60 degrees. An upright position is vital for preventing aspiration and choking during meals. Question 122. What should a nursing assistant do to protect dentures from damage during cleaning? Option A, hold them with a cloth. Option B, line the sink with a towel or fill with water. Option C, use a metal scraper. Option D, only use boiling water. The correct answer is option B, line the sink with a towel or fill with water. Patting the sink prevents the dentures from shattering if they are accidentally dropped. Question 123. How should water for cleaning dentures be characterized? Option A, boiling hot. Option B, ice cold. Option C, lukewarm. Option D, soap and bleach. The correct answer is option C, lukewarm. Lukewarm water cleans effectively without warping the plastic material of the dentures. Question 124. What is the technique for log rolling a resident with hip fracture precautions? Option A, use one person to pull quickly. Option B, roll the resident onto the injured side. Option C, keep the head, spine, and legs aligned in a single movement. Option D, twist the shoulders first. The correct answer is option C, keep the head, spine, and legs aligned in a single movement. Log rolling maintains perfect spinal and hip alignment to prevent further injury. Question 125. How often should mouth care be provided for an unconscious resident? Option A, once per shift. Option B, every 2 hours. Option C, once a day. Option D, only when they wake up. The correct answer is option B, every 2 hours. Unconscious residents cannot clear saliva or hydrate their mouths, leading to infection risk. Question 126. When giving a back rub, what kind of strokes should be used to cross the shoulders? Option A, long, firm strokes. Option B, short circular strokes. Option C, rapid tapping. Option D, a heavy pressure with the elbows. The correct answer is option B, short circular strokes. Circular motions help stimulate circulation and provide relaxation in the shoulder area. Question 127. If a nursing assistant notices redness or skin breakdown during a back rub, what should they do? Option A, rub the area harder to improve blood flow. Option B, apply extra lotion and ignore it. Option C, do not rub the reddened area and report it to the nurse. Option D, cover it with a heavy bandage. The correct answer is option C, do not rub the reddened area and report it to the nurse. Massaging a pressure injury can cause further deep tissue damage. Question 128. When providing foot care, what is a critical safety rule for nursing assistants? Option A, always use a sharp metal file. Option B, do not clip the resident's toenails. Option C, soak the feet in cold water for an hour. Option D, apply lotion between the toes. The correct answer is option B, do not clip the resident's toenails. Toenail clipping is often restricted to nurses or podiatrists due to high risk of injury and infection. Question 129. When dressing a resident with hemiplegia, which side of the garment should be put on first? Option A, the strong side. Option B, the side the resident chooses. Option C, the weak side. Option D, both sides at once. The correct answer is option C, the weak side. Dressing the weak side first allows for easier manipulation of the garment over the limb with limited movement. Question 130. When shaving a resident's face with a razor blade, how should the skin be held? Option A, loose and folded. Option B, gently pulled taut. Option C, pushed downward. Option D, it should not be touched. The correct answer is option B, gently pulled taut. Taut skin provides a flat surface for the razor and reduces the risk of nicks and cuts. Question 131. In which direction should a nursing assistant shave a resident's face? Option A. Against the direction of hair growth. Option B. In the direction the hair is growing. Option C. In a circular motion. Option D. From side to side. The correct answer is option B. In the direction the hair is growing. Shaving with the grain prevents skin irritation and ingrown hairs. Question 132. When providing perineal care for a female, what is the correct cleaning direction? Option A. From back to front. Option B. From the thighs to the labia. Option C. From front to back. Option D. In a circular motion. The correct answer is option C. From front to back. Washing from front to back prevents the spread of fecal bacteria into the vagina or urethra. Question 133. When cleaning the anal area during peri-care, in which direction should you wipe? Option A. From front to back. Option B. From the rectum toward the vagina. Option C. From side to side. Option D. Only in circles. The correct answer is option A. From front to back. Cleaning away from the cleaner areas toward the rectum maintains hygiene and prevents infection. Question 134. What is the correct way to position a fracture pan under a resident? Option A. With the deep side toward the head. Option B. With the flat side toward the back of the resident. Option C. With the handle facing the resident's face. Option D. On top of the resident's thighs. The correct answer is option B. With the flat side toward the back of the resident. The flat end of the pan is designed to slide under the buttocks with minimal lifting. Question 135. When collecting a stool specimen, what should be done with the specimen cup after the lid is secured? Option A. Leave it on the resident's bedside table. Option B. Place it into a transport or biohazard bag. Option C. Carry it in your pocket. Option D. Put it in the regular trash. The correct answer is option B. Place it into a transport or biohazard bag. Biohazard bags protect staff and the environment during the transport of human waste specimens. Question 136. What does the abbreviation AC stand for in a resident's medical records? Option A. After meals. Option B. At bedtime. Option C. Before meals. Option D. As needed. The correct answer is option C. Before meals. The abbreviation AC comes from the Latin ante cibum, meaning before meals. Question 137. What does the abbreviation PC stand for? Option A. Prior care. Option B. After meals. Option C. Patient choice. Option D. Physical comfort. The correct answer is option B. After meals. The abbreviation PC comes from the Latin post cibum, meaning after meals. Question 138. What does the abbreviation BID mean regarding medication or treatment? Option A. Once a day. Option B. Twice a day. Option C. 3 times a day. Option D. Every other day. The correct answer is option B. Twice a day. This means the task is performed 2 times in a 24-hour period. Question 139. What does the abbreviation TID mean? Option A. 2 times a day. Option B. 3 times a day. Option C. 10 times daily. Option D. Total intake daily. The correct answer is option B. 3 times a day. This means the task is performed 3 times in a 24-hour period. Question 140. What does the abbreviation QID mean? Option A. Once a day. Option B. Every hour. Option C. 4 times a day. Option D. Every other day. The correct answer is option C. 4 times a day. This means the task is performed 4 times in a 24-hour period. Question 141. What does the medical term barium enema refer to in shorthand? Option A. BE. Option B. BA. Option C. EN. Option D. BM. The correct answer is option A, BE. ABE is an imaging test used to examine the lower gastrointestinal tract. Question 142. What does the abbreviation DX stand for? Option A, daily exercise. Option B, diagnosis. Option C, dosage. Option D, drainage. The correct answer is option B, diagnosis. A diagnosis is the identification of the nature of an illness or other problem. Question 143. What does the abbreviation FX stand for in orthopedics? Option A, function. Option B, fracture. Option C, friction. Option D, flexion. The correct answer is option B, fracture. FX is the common clinical shorthand for a broken bone. Question 144. What does the abbreviation GB stand for? Option A, gastric bypass. Option B, gallbladder. Option C, goal balance. Option D, general body. The correct answer is option B, gallbladder. The gallbladder is the organ that stores bile for digestion. Question 145. What does the abbreviation H or HR stand for? Option A, head. Option B, high. Option C, tower. Option D, heart. The correct answer is option C, hour. An hour is a unit of time equal to 60 minutes. Question 146. What does the abbreviation HT stand for? Option A, heart. Option B, height. Option C, heat. Option D, high. The correct answer is option B, height. Height is the measurement of a person from head to foot. Question 147. What does the abbreviation HX stand for? Option A, history. Option B, height. Option C, heart. Option D, high. The correct answer is option A, history. History refers to a resident's past medical conditions and treatments. Question 148. What does the abbreviation INO stand for? Option A, in and out. Option B, intake and output. Option C, internal and oral. Option D, confection and observation. The correct answer is option B, intake and output. Intake and output measures the amount of fluid a person consumes and excretes. Question 149. What does the abbreviation IV stand for? Option A, internal valve. Option B, individual visit. Option C, intravenous. Option D, involuntary. The correct answer is option C, intravenous. Intravenous refers to medications or fluids delivered directly into a vein. Question 150. What does the abbreviation LB stand for? Option A, lower body. Option B, pound. Option C, lobar. Option D, long bone. The correct answer is option B, pound. The pound is a unit of weight used in medical documentation. Question 151. What does the abbreviation LIQ stand for? Option A, light. Option B, liquid. Option C, limited. Option D, lower. The correct answer is option B, liquid. Liquid refers to fluid substances provided to or produced by the resident. Question 152. What does the abbreviation LLQ stand for? Option A, lower left quadrant. Option B, left lower quadrant. Option C, lower level quantity. Option D, light level quality. The correct answer is option B, left lower quadrant. The left lower quadrant is a specific anatomical area of the abdomen. Question 153. What does the abbreviation LUQ stand for? Option A, lower upper quadrant. Option B, left upper quadrant. Option C, level upper quantity. Option D, light under quality. The correct answer is option B, left upper quadrant. The left upper quadrant is a specific anatomical area of the abdomen. Question 154. What does the abbreviation RLQ stand for? Option A, right lower quadrant. Option B, routine lower quantity. Option C, right level quality. Option D, rear left quadrant. The correct answer is option A, right lower quadrant. The right lower quadrant is a specific anatomical area of the abdomen. Question 155. What does the abbreviation RUQ stand for? Option A, right upper quadrant. Option B, routine upper quality. Option C, right under quantity. Option D, rear upper quadrant. The correct answer is option A, right upper quadrant. The right upper quadrant is a specific anatomical area of the abdomen. Question 156. What does the abbreviation LOC stand for? Option A, left of center. Option B, level of consciousness. Option C, loss of contact. Option D, line of care. The correct answer is option B, level of consciousness. Level of consciousness measures a person's responsiveness to their environment. Question 157. What does the abbreviation NPO stand for? Option A, new patient only. Option B, nothing by mouth. Option C, normal pulse only. Option D, nighttime positioning only. The correct answer is option B, nothing by mouth. Nothing by mouth is in order to stop all food and fluid intake. Question 158. What does the abbreviation PO stand for? Option A, postoperative. Option B, partial observation. Option C, by mouth. Option D, a phone order. The correct answer is option C, by mouth. The abbreviation PO comes from the Latin per os, meaning by mouth. Question 159. What does the abbreviation PRN stand for? Option A, primary resident need. Option B, as needed. Option C, partial record note. Option D, a physical restraint note. The correct answer is option B, as needed. The abbreviation PRN comes from the Latin pro re nata, meaning is necessary. Question 160. What does the abbreviation Q stand for in medical timing? Option A, quiet. Option B, every. Option C, quantity. Option D, quick. The correct answer is option B, every. The abbreviation Q comes from the Latin quisque, meaning every. Question 161. What does the abbreviation QH stand for? Option A, quiet hour. Option B, quick help. Option C, every hour. Option D, equality high. The correct answer is option C, every hour. This indicates a task is performed once every 60 minutes. Question 162. What does the abbreviation QD stand for? Option A, equality daily. Option B, every day. Option C, quiet day. Option D, quick dose. The correct answer is option B, every day. This indicates a task is performed once every 24 hours. Question 163. What does the abbreviation QOD stand for? Option A, equality of diet. Option B, every other day. Option C, quiet observation daily. Option D, quick onset daily. The correct answer is option B, every other day. This indicates a task is performed on alternating days. Question 164. What does the abbreviation ROM stand for? Option A, read-only memory. Option B, range of motion. Option C, routine oral meds. Option D, right of movement. The correct answer is option B, range of motion. Range of motion exercises are used to maintain joint flexibility. Question 165. What does the abbreviation SOB stand for? Option A, stable or balanced. Option B, shortness of breath. Option C, skin on bone. Option D, side of bed. The correct answer is option B, shortness of breath. Shortness of breath is a clinical symptom that requires reporting. Question 166. What does the abbreviation SSE stand for? Option A, side-side exercise. Option B, simple skin exam. Option C, Soapsuds enema. Option D, surgical site exam. The correct answer is option C, Soapsuds enema. A Soapsuds enema is used to relieve constipation or clear the bowel. Question 167. What does the abbreviation STAT mean? Option A, stop. Option B, at once or immediately. Option C, stable. Option D, start. The correct answer is option B, at once or immediately. Stat comes from the Latin statum, meaning right now. Question 168. What does the abbreviation TPR stand for? Option A, total patient recovery. Option B, a temperature, pulse and respirations. Option C, time, pressure and rate. Option D, timed patient report. The correct answer is option B, temperature, pulse and respirations. Temperature, pulse, and respirations are the basic vital signs. Question 169. What does the abbreviation UA stand for? Option A, unit assistant. Option B, urinalysis. Option C, underarm. Option D, upper abdomen. The correct answer is option B, urinalysis. A urinalysis is a laboratory test of a urine specimen. Question 170. What does the abbreviation VS stand for? Option A, a very small. Option B, a vital signs. Option C, a visual survey. Option D, a valuable stuff. The correct answer is option B, vital signs. Vital signs provide objective data about a person's basic body functions. Question 171. What does the abbreviation WBC stand for? Option A, whole body care. Option B, white blood cell. Option C, weight by choice. Option D, weak body condition. The correct answer is option B, white blood cell. White blood cells are the primary infection-fighting cells of the body. Question 172. What does the abbreviation WC stand for? Option A, with care. Option B, wheelchair. Option C, water closet. Option D, warm compress. The correct answer is option B, wheelchair. A wheelchair is a standard assistive device for non-ambulatory residents. Question 173. What is the definition of an acute illness? Option A, a permanent condition. Option B, an ongoing illness with no cure. Option C, a sudden illness from which the person is expected to recover. Option D, an illness that only affects the heart. The correct answer is option C, a sudden illness from which the person is expected to recover. Acute illnesses have a rapid onset and a relatively short duration. Question 174. What is the definition of a chronic illness? Option A, a sudden illness that goes away. Option B, an ongoing illness that is slow or gradual in onset and has no known cure. Option C, an illness caused by a fall. Option D, a temporary loss of memory. The correct answer is option B, an ongoing illness that is slow or gradual in onset and has no known cure. Chronic illnesses like diabetes or arthritis require long-term management. Question 175. What is a terminal illness? Option A, an illness that results in a full recovery. Option B, an illness for which there is no reasonable expectation of recovery. Option C, a minor cold or flu. Option D, an injury to the foot. The correct answer is option B, an illness for which there is no reasonable expectation of recovery. Terminal illnesses lead to the dying process and require comfort care. Question 176. What is an assisted living residence? Option A, a locked psychiatric hospital. Option B, a facility that provides housing and help with daily activities. Option C, a community for independent children. Option D, a surgical center. The correct answer is option B, a facility that provides housing and help with daily activities. Assisted living is for people who need some support but not 24-hour nursing care. Question 177. Who is the director of nursing? Option A, the person who cooks the meals. Option B, the registered nurse responsible for the entire nursing staff. Option C, the doctor who owns the building. Option D, the resident advocate. The correct answer is option B, the registered nurse responsible for the entire nursing staff. The director of nursing is the highest clinical administrator in a facility. Question 178. What is a skilled nursing facility? Option A, a place where residents do not receive any help. Option B, a facility that provides 24-hour nursing care and rehabilitation. Option C, a group home for people under 30. Option D, a place for vacations. The correct answer is option B, a facility that provides 24-hour nursing care and rehabilitation. These facilities are for residents with complex medical and therapy needs. Question 179. What does A&O times 0 mean? Option A, the person is fully aware. Option B, the person is awake but not aware of anything. Option C, the person is sleeping. Option D, the person knows their name only. The correct answer is option B, the person is awake but not aware of anything. This indicates a total lack of orientation to person, place, or time. Question 180. What does A&O times 1 mean? Option A, the person knows where they are. Option B, the person is aware of themselves. Option C, the person knows the date. Option D, the person knows their doctor. The correct answer is option B, the person is aware of themselves. This means the resident is only oriented to their own identity. Question 181. What does A&O times 2 mean? Option A, the person knows the time. Option B, the person is aware of self and place. Option C, the person knows the events of the day. Option D, the person is fully oriented. The correct answer is option B, the person is aware of self and place. Orientation to self and location is a mid-level of cognitive function. Question 182. What does A&O times 3 mean? Option A, the person is aware of self, place, and date or time. Option B, the person is confused about their name. Option C, the person is unconscious. Option D, the person only knows their name. The correct answer is option A, the person is aware of self, place, and date or time. Times 3 is a common standard for basic mental clarity in residents. Question 183. What is the definition of respite care? Option A, care provided to a resident for the rest of their life. Option B, short-term care provided to a person at home to give their family a break. Option C, emergency care for a broken bone. Option D, a type of dental surgery. The correct answer is option B, short-term care provided to a person at home to give their family a break. Respite care supports family caregivers by providing temporary facility placement. Question 184. Who is the healthcare professional that helps restore physical function like walking? Option A, occupational therapist. Option B, physical therapist. Option C, social worker. Option D, speech therapist. The correct answer is option B, physical therapist. Physical therapists focus on mobility, strength, and gross motor skills. Question 185. Who helps a resident return to their activities of daily living like dressing? Option A, a physical therapist. Option B, occupational therapist. Option C, social worker. Option D, a dietitian. The correct answer is option B, occupational therapist. Occupational therapists specialize in fine motor skills and daily tasks. Question 186. What is Medicare? Option A, federal health insurance for people aged 65 or older. Option B, state insurance for newborn babies. Option C, insurance provided by a local church. Option D, private insurance for wealthy people only. The correct answer is option A, federal health insurance for people aged 65 or older. Medicare is a federal program that supports the healthcare of the elderly. Question 187. What is Medicaid? Option A, insurance only for people with cancer. Option B, a program sponsored by the government and run by the state for low income. Option C, insurance provided by an employer. Option D, a type of bank account. The correct answer is option B, a program sponsored by the government and run by the state for low income. Medicaid provides healthcare access based on financial and medical need. Question 188. What is the primary role of an ombudsman? Option A, to perform medical exams. Option B, to help residents voice grievances and protect their rights. Option C, to manage the facility's finances. Option D, to drive the transport bus. The correct answer is option B, to help residents voice grievances and protect their rights. Ombudsmen act as independent advocates for residents in long-term care. Question 189. How are restraints ordered? Option A, by the nursing assistant. Option B, by the resident's family. Option C, by a doctor's order. Option D, by the facility manager. The correct answer is option C, by a doctor's order. Restraints are a medical intervention that must be legally authorized by a physician. Question 190. What is the definition of aiding and abetting? Option A, helping a resident walk. Option B, having knowledge of a crime without being present. Option C, cooking a meal for a coworker. Option D, reporting a safety hazard. The correct answer is option B, having knowledge of a crime without being present. This is a legal term for being involved in or having knowledge of an illegal act. Question 191. What is the definition of ethics? Option A, the laws of the state. Option B, the knowledge of what is right and wrong. Option C, the facility's dress code. Option D, the religious beliefs of the doctor. The correct answer is option B, the knowledge of what is right and wrong. Ethics guide the moral and professional behavior of healthcare workers.